The cornea is the clear tissue right in the front of your eye. It's kind of like the windshield of a car. It's what we use to see out to the world. And diseases that affect the cornea, of course, can cloud up that clear, transparent tissue and blur your vision. Corneal transplantation is a visual rehabilitation for the eye for patients specifically who have diseases only of the cornea. You can think of your eye as a camera. It has a lens in the front and a film in the back. Well, if the lens in the front is the only thing that's damaged, we can replace that with a corneal transplant. And we can restore the clarity of the front part of the eye. However, there's more to a camera than just the lens in the front. And if the mechanism of the eye, if the internal workings of the eye are damaged or not functional, then just replacing the lens or the cornea in the front of the eye won't restore vision. So the tissue for a corneal transplant comes from basically generous donors around the area of southern Louisiana. At the Southern Eye Bank, we receive over 700 to 800 donations per year for corneal transplantation. Now, of course, not all of this donated tissue can be used. We screen out tissue depending on age and other medical history. But corneal transplant tissue, again, is dependent upon generous donors in order for us to perform the surgery successfully. The main reasons for corneal transplantation are diseases that can cloud up your cornea. Things like Fuchs dystrophy, which is an inherited disorder that causes swelling in the cornea. Trauma, which can cause injury and scarring in the cornea. Keratoconus, which is a disease that causes your cornea to be abnormally shaped. And other diseases that can, again, scar or damage the shape of the cornea so that it needs to be replaced. So when diseases affect the cornea, we can do transplants of one of several different ways. The traditional way of doing a corneal transplantation is called penetrating keratoplasty. And with penetrating keratoplasty, we actually remove the entire thickness, the full cornea, and transplant tissue that's been donated by a generous donor in order to replace the transparency of the cornea and restore vision. Current techniques in corneal transplantation involve removing just specifically the diseased portions of the cornea so that the patient can retain as much of their natural cornea as possible. These types of procedures are called lamellar transplantation. One such procedure is called endothelial keratoplasty, or DSEK. And with DSEK surgery, what we do is we remove just the inner lining of the cornea, and we replace just the inner lining of the cornea. That's called the endothelium. 90% of the patient's cornea, the front part of the cornea, remains intact. There's no sutures involved with this technique, and the healing time is much faster than a traditional penetrating keratoplasty. So it's really a significant advance in the techniques that we use for corneal transplantation. The diseases that we can treat with DSEK surgery or endothelial keratoplasty are diseases such as Fuchs dystrophy, which is an inherited disorder that affects just the posterior aspect or the back layer of the cornea. Also, some cases of bullous keratopathy, which is a premature aging of the cornea that can happen after you've had multiple surgeries, can also be treated this way. Once you and your surgeon have decided that a corneal transplant is necessary, your surgeon will schedule your surgery according to his normal surgical schedule. There's no need to be put on a waiting list for corneal transplant tissue. Unlike other organ transplants such as heart surgery or liver transplantation, there's no need to be on a long waiting list. Corneal transplant tissue, once screened and evaluated by the Southern Eye Bank, is readily available for our surgeons. The tissue is only good for about a week or so, so typically we're dependent on donors that week in order to perform a surgery. Sometimes it's necessary to reschedule a surgery simply because there's not donor tissue available that week. The most common procedures performed in eye surgery are procedures such as cataract surgery and glaucoma surgery. But corneal transplantation is not an uncommon procedure. We perform in Louisiana over 500 corneal transplants per year. The diseases that require corneal transplantation are things like Fuchs dystrophy, keratoconus, any kind of swelling or opacity in the cornea, trauma that can cause corneal scarring, infections that can cause corneal scarring. These types of things can limit your vision because they affect the cornea, the clear tissue in the front of the eye, and those are the patients that often need a transplant. The success rate for a corneal transplant is over 90% in a healthy eye. So as long as there's not other disease or other problems in the eye, corneal transplantation is a very successful procedure. All transplant tissue that's received is thoroughly screened and evaluated at the Southern Eye Bank. We screen not only for obviously common diseases that we'll discard tissue for, but also for the quality, the clarity, and the freshness of the tissue so that we get the best results. Because the cornea is a clear tissue, it doesn't change the color of your eye. Now, sometimes patients who require corneal transplants have a white scar or something on their eye, and that actually can sometimes be removed and replaced with a clear tissue. But the color of your eye, whether your eye is green or brown or blue, that won't change after corneal transplant. Traditional corneal transplantation involves using very, very fine sutures to sew the graft into place. Those sutures often remain in the eye for up to a year and can be removed later at a simple clinic visit. So some of our newer techniques, such as DSEC or endothelial keratoplasty, is performed without sutures, which is a great advantage to patients because sutures often cause a little bit of irregularity. Naturally, when we're sewing in a graft by hand, it's not perfectly smooth. So if we can avoid using sutures, such as in lamellar transplantation procedures such as DSEC, then that's a tremendous advantage to patients. Patients who receive a corneal transplant often have irregular astigmatism. What irregular astigmatism means is that because we're sewing that graft in by hand using very, very fine sutures, the surface of the cornea is not always perfectly smooth. Instead, it has lumps and bumps in it. So we often have to place a contact lens over the surface of the eye in order to get your best vision, in order to restore that smooth surface. Corneal transplant surgery typically takes about an hour to perform, and it can be done either under local anesthesia, meaning we can numb up just the eye area and you'll still be awake but sedated, or it can be done under general anesthesia where you're completely asleep and unaware of anything that's going on. Corneal transplant surgery is typically done as an outpatient procedure, meaning you'll come in the morning and you'll go home that same day. It's rare for patients to have to stay in the hospital overnight unless there's some other medical problems. So if you're scheduled for corneal transplant surgery, instructions will certainly be given to you by your surgeon and your surgeon's office. But it's important to remember a couple of things that you'll certainly be reminded of again. Number one, don't eat anything after midnight the night before your surgery. Number two, take any medications that are prescribed for you in order to prepare your eye for the surgery. And also fill any prescriptions that you might need immediately after surgery so that you can be prepared to start putting your drops in the day after surgery. Immediately following corneal transplantation surgery, your eye is going to feel somewhat sore and scratchy, of course. That's natural. But as soon as the skin heals over the eye, which only takes on the order of 3 to 5 days, the eye starts to feel normal again. There's some discomfort after surgery, but no real pain, I would say. It feels uncomfortable, kind of scratchy for the first week or so, but once the skin of the eye is healed over, usually patients feel pretty normal again, and usually you can resume most of your normal activities within 5 to 7 days after a corneal transplant. So when you receive a corneal transplant, typically you're going to have a patch over your eye for the first 24 hours. The next day you'll see your surgeon and that patch will be removed. The eye is often pretty red, just a little bit of a bleeding underneath the conjunctiva, but that's normal and it's nothing to be alarmed about. So the eye is normally a bit red, but you won't be able to see a white spot or anything like that from the transplant. The transplant tissue is relatively clear, usually a little swollen. So your eye will look pretty normal, just kind of red and like you just had surgery. The redness will probably last about 10 to 14 days, and then usually that absorbs. It's almost like a bruise around the eye. And typically the cornea gets clear over the next few months, but you won't be able to see a difference when you're looking at the eye. Your vision should slowly improve over the first 3 to 4 months. So So after you've received a corneal transplant, the most important thing in the immediate post-op period is to be pretty cautious with the eye. Typically there's sutures in place and the eye is very fragile for the first month or so, so you have to refrain from any vigorous activity. We don't want you to go run marathons or get in any boxing matches the first month after surgery. But you can certainly resume your normal activities within a week or so. It's important, of course, to take the medications that your surgeon prescribes. Typically that's antibiotics, some anti-inflammatory, anti-rejection medicines, and also a lubricating teardrop just to keep the surface of the eye moist. So those are the most important things, to protect the eye and make sure you take your medications and follow up with your surgeon. So eye drops typically come in small plastic vials like this, and it's important to keep the top sterile, so keep the top on the bottle whenever you're not using it. In order to apply an eye drop properly to the eye, the easiest thing is to either have a mirror, or if you don't have a mirror you can do it without, but just pull the lower part of your eyelid down. When you do that, there's a little space there, a little crevice there, so if you pull your lower eyelid down and look up, you can and tilt your head back as well. Use gravity to your advantage. So pull your lower eyelid down, look up, and apply the drop simply like that. It's important not to touch the surface of your eye with the tip, because we want to keep that tip as clean as possible. And as soon as you're done putting in the drop, you want to put the lid back on the eyedropper. If you're taking both drops and ointment, it's important to put the drops in first. The ointment forms a nice covering over the eye, but if you try and put a liquid eye drop on top of an ointment, it's not going to get into the eye very well. It's also important to space your eye drops apart, probably about 5 minutes apart when you have multiple drops to put in at the same time. Receiving a corneal transplant is really a miracle, and oftentimes patients ask me if there's any way that they can reach out and communicate to the families of these generous donors who provided a really tremendous gift for them to be able to see again. All corneal transplant donations are anonymous, but we certainly have records within the Southern Eye Bank so that if you're interested in communicating to the families of the donors for your corneal transplant, we can certainly arrange for that through the Southern Eye Bank. Anytime you've had a corneal transplant, it's important to be aware of changes in your eye. If you've noticed any redness, any pain, or any decrease in vision, it's important to be evaluated pretty quickly, because those can be signs of a corneal graft rejection. And corneal transplant rejection can happen even years after you've had surgery. If you've received a corneal transplant and there's some kind of catastrophe like Hurricane Katrina that happens and you're displaced from your home, really the key is to keep on your medications. So typically transplant patients are on prednisone drops in order to prevent graft rejection. And if you're in that period where you're still on those medications, it's important to continue those. And those are common medications that are available anywhere in the United States. So it's really just a matter of maybe calling the office and getting those medications so that you can always have prescriptions. It's also a good idea to keep an extra bottle of the medication around in case you lose a bottle or you're traveling and you forget it. Once you leave the hospital after you've had your corneal transplant, your eye will be patched. There'll be a patch over your eye and often a little plastic or metal shield to protect the eye as well. That patch should typically remain on the eye until you've seen your surgeon the next day. They'll remove the patch and take a look at the eye and make sure everything's going okay. So whether you're considering a corneal transplantation or you have already had a transplant, it's important to be involved with your care. Ask your surgeon specific questions that you have and follow instructions carefully.